Well, good morning, everybody, and welcome to this slightly delayed session. Thanks for your patience from the previous time. We're going to do a very informal session here today. My name's Andy Bleaden. I work for the ECHAlliance. We're a connector, a member organisation. We bring our members together in a series of international ecosystems over the globe. I've got some leaflets I should dish out in a moment about those. But I'm not here to talk about what we do. I'm here to talk about what we can do within Malta around reinvigorating the Malta digital health ecosystem and where it's going to be going in the future. So I'm going to get input from 4 fantastic speakers today. I'll let them introduce themselves just briefly, starting with Malcolm, to tell us who you are for those people who don't know you and what you...
Good morning. I'm �W𝐞𝐝-𝐓𝐞𝐜�. I'm a medical doctor by profession. In fact, I'm still a practicing family doctor in the private health sector in Malta. Apart from that, I am also involved into politics. I'm a member of parliament. I am the chairperson of the permanent secretary of the health committee within the parliament.
Gertrude Buttigieg, I'm chairperson of the Malta Health Network, which is an umbrella organization which brings together health-related organizations. We have 40 members. And in my full-time job, I work for the Commissioner for the Rights of Persons with Mental Health Problems.
So, Robert, specialist in cyber defense and advanced operations at Malta Information Technology Agency. We basically take care for all aspects of cybersecurity within the government of Malta.
Brian Muscat, from Malta as well. I'm an enterprise architect with the health team. Basically, we work on government-related projects related to health. Our team is the developer of My Health. That's basically.
Thank you very much. So, just a quick question. And with a show of hands, how many people live within Malta here today? Including yourselves, obviously. Yes. Okay, that's helpful. So, what we're looking to do today was ask some just intriguing questions from 4 or 5 different angles, from patient side, from political side, from medical side, from company side, from data side, about that ecosystem in Malta. So, coming to you first, Gertrude, from the patient side, what do you think are the opportunities here for Malta and the ecosystem for the future? And what should the priorities be?
Okay, from a patient perspective, I think technology and getting together digitally is important. Technology is here. Technology is here to stay. So we might as well grasp the ropes of what can be done to help the patient community understand their situation, from diagnosis to treatment to care to self-management. I think technology is the tool to help the patient navigate the system and manage their medical condition, be it something acute and being a more chronic situation.
Thank you for that. Now I'm going to come to you, Malcolm. You got 2 hats here. So I always think this is kind of easy. On the medical side, what do you think are the priorities that should be here for the Malta digital health ecosystem for the future?
From the medical aspect, basically we've got quite a lot of challenges still, especially me as a private GP. Because the thing is, as a private GP, I happen to, although participating actively within the system, in fact, 70% of the Maltese population do use the private GP sector, yet it is still quite considered as alien compared to the rest of the primary care theme. So basically, I think we have quite a lot of challenges, particularly with the information technology sector, like, for example, the health systems, which must be available to the private family doctors in their entirety. Because the problem is that sometimes people do come in to seek you for their help, to come in for their concerns, maybe second opinions, maybe to explain to them what the other specialists did tell them, because they obviously do much more easily accessible and you can give them more time. And yet you can't really speak to them and you can't really give them all the information because you can't access that data. So the thing is that I feel that in Malta, as a doctor, we need more systems that are more widely available, and yet much more information on those systems. But obviously there are quite a lot of challenges for that, particularly with the control of it, because one of the most important aspects of that, without going into it, is that a lot of people are not really happy that their information, and they've got quite a bad perception at times, that the information present on the cloud can be easily available to anyone. And so they're not really keen, and they will tell you, what if my data finish up in some other's hands, and basically, which I don't really want. And I think that we have to juggle between those perceptions and realities, in fact. And I think this is the way forward.
So that's from the medical side. Now,
That's from the medical side.
Taking off your hat and your stethoscope and putting on your political badge. What's the...
It's quite difficult for me to juggle between the two, yet till now I'm managing. The only thing is that from the political side, I found out that regarding the policies, still I think we have a lot to do. Because the problem is that we need to reach out to all the healthcare professionals. Because we must keep in mind that there's a whole team which is taking care of the patient. And there's the individual, the patient at the end of the day, but the patient has got a whole range of different medical professionals who are taking care of him. And all those people must come on board through digitalization, because that's the way that they put everyone putting his inputs. And I feel, although I'm come from the medical side, from a GP point of view, but I think that the GP himself must be the manager who's going to have access to all the data and be able to manage and make sure that the patient is having proper management without failing in some way or another. Because the thing is, if you manage to find out that the patient is going to fall into a particular trap, with the aid of digitalization, you can ensure that he doesn't do that.
If only we had somebody who could build a platform. We do. Brian, so what do you think from your perspective?
Basically, the health system is already quite developed, but I think we can take a number of actions to update it. Basically, I believe there are three pillars we need to speak about here. First, making data more available to the private sector, mainly GPs and patients. And then we need the private sector to feed in back to the public sector. So we have one consolidated health system. This doesn't work without a strong patient consent system. So we definitely need to invest in that area to first build a strong patient consent system and then build the data flows between the two. Another point is the interoperability between systems. Currently, we are in a situation where we have a huge number of systems that are still silos, departments that don't talk together. So we need to fix that and start having departments talking together and not just having your data and your data. We build the knowledge together get the whole picture of the patient. And finally, I think there's a opportunity to nowadays invest into AI, into purpose-built AIs that can help us both from patient management, could be from simple appointment management systems. There are AIs that can help you there. Then going also to radiology, where there's huge investments when it gets to AI. So I believe there is a lot where we can improve.
Okay. On the data front, Robert, what do you think should be the priority? Because you're more just good old-fashioned security and cybersecurity and data.
I honestly fully agree with all, obviously, the comments made by the members of the panel. It seems that a quite obvious problem is currently synergy between the different stakeholders. So, and without that synergy, and even patients can feel the lack of synergy, as Dr. Malcolm was saying, patients go to their private GP. Unfortunately, they only have access to a limited amount of information. So that leads to patients possibly not having full trust in the healthcare system and start asking questions. Why this data is not available? And obviously, if we were to move to that phase where information is available to the different stakeholders, we need to build then trust differently. We need to be more transparent in all the workflows and processes that are part of this ecosystem. And because only that transparency would gain trust and basically rejuvenate the whole ecosystem, because you would have the patients and all stakeholders on board, which can only be the only way for success. In terms of security and securing data, we seem to have this perception. We have a lot of compliance standards, HIPAA, etc. And unfortunately, there's a lot of belief that if you're compliant to this specific standard, you're obviously secure. And unfortunately, that is a very bad misconception, because what these standards are obviously providing is a snapshot in time, and they don't keep up with the evolving, shifting sense of cybersecurity, which, as you hear nowadays, every day there is a data breach there is a hacking attempt there, etc., etc. So what we need is people to have more trust eventually when this ecosystem can start operate in a more synergetic way, with each stakeholder having an advanced security program that runs throughout and not only for compliance purposes.
Okay. So I think we've got at least one topic to take to bring together all the stakeholders within Malta, and that's data, and managing data. So I think that's a first go-to piece we can help with the ECHAlliance, and bring in both stakeholders from within Malta, but also then from outside to learn what other people have failed at, most importantly, because that's one of the better lessons, but also where they succeed too. Because I think that's important of having that international network, is to learn from other people's failures. And there's plenty of them, trust me. And when you go across 70 ecosystems, you see the same issues being brought up, different ways of managing them. So, back to you, because Gertrude, you've been around with the ecosystem here in Malta for a number of years. I'm
Yes.
too polite to say how many, but what do you think the benefits of do you think you can bring into Malta from being within that international network would be?
I think on a personal level, I learned a lot, because over COVID, we used to join the satellite meetings, we used to organize, and we learned a lot. There were various best practices shared, and as well difficulties shared. And I think for me personally, it used to be an opportunity to be on these meetings and learn from others. So I think education and information are key at all levels. But also, what has been crossing my mind as these gentlemen were talking was the ownership of data. And when we got the cross-border healthcare directive, there was the issue of e-prescribing and electronic patient records. And for me, that is very important as a patient representative, because if I need to access healthcare, I would not like my GP to control my access. I need to have a degree of control for myself. I would like my doctor to help me manage my condition, but as a patient, I need to be in control for the decisions being taken about me.
We're getting a red light here, which means we've got 5 minutes, just over 6 minutes left. What do you think, and what would the benefits of bringing in more, what would be the benefits for you from bringing in more from the international perspective be, do you think?
Of course, most important thing is knowledge. Because the thing is that you know a lot of information, but you never know enough. And particularly here, I'm speaking to on a national level, I think we still need to look forward to a lot of new systems which we can adopt. In particular with this mega project, I would say, of merging all this information and putting all this information as well on a digital platform. because one of the main problems is that still in Malta we've got a lot of information which is still on paper. Yeah. And one of the main problems is to transfer that data onto the digital platform, and that takes years. So the thing is that we still need to find something, what we're going to need to do in the meantime, because we still need to keep the system going. So I think that's one of the main challenges which we're going to face in the near future, and I feel that we need to learn a lot from other ecosystems. How did they manage, obviously, to overcome this major challenge? Allow me to say another important point. There's also the important aspect. Maybe the foreign people here are much more accustomed to it, about the medical legal aspect of it. And that I feel that's really, really important. Because the thing is, as a doctor, I have to think with a legal mind as well. So it's very, very important that we must ensure that the data is very well controlled, particularly what is available to everyone on board, and obviously the patient's rights to know his data and to access that data. Because the thing is that can lead us into a lot of legal issues, which we must, and it's really, really important to keep them in mind.
Absolutely, can't agree with you more. How is he going to do that with an input from an international angle, do you think?
First of all, I think one needs to work on an open standard, on a common framework to enable interoperability, as my colleague Brian was mentioning. But before, obviously, going to that route, we need to set systems and frameworks having security and privacy by design, not as an afterthought. Okay. That is one of the pain points that I think it is also very prevalent in Malta, that we think about security and privacy in some of the projects, not to say most of them, as an afterthought, which obviously after some time to fix legal and also security issues, that would mean that the client is potentially impacted from the relevant services and also not getting the full benefit of having access to data shared within the different stakeholders.
Okay, thank you. Brian?
From my end, obviously, and to enable all this, first we need to start working on a much needed electronic health record, a national electronic health record that at the end of the day will enable us to share more with the private sector feeding into the public sector, and eventually that will further enable us to then share across the EU, even if patients need to go abroad to share their data abroad, or even if they have an emergency abroad, it will help us and expedite that process. Because at the moment, to provide this data and collect this data with a lot of silo systems, a lot of separate integrations, that each and every integration, we need to tackle security, we need to tackle all the nuts and bolts that take a lot of time and takes a lot of effort. And obviously then we need to look also at AI to start improve our processes and help us expedite certain areas. That's what I think will be the key areas that we need to work in the next couple of years.
Okay, we've got 1 minute left. I'm going to ask quick answers to the following question. If we were to host an ecosystem session on health data, should we do it virtually or in person? What do you think?
Today, I still think that in person is really much more, I think it's better.
Hybrid? We'll come back to that in a minute.
Virtual technology is an enabler, security is an enabler.
Okay.
For day-to-day, virtual is important, but to get people that don't know each other to start speaking in person is very important.
Okay. Now then, we've got 28 seconds left. I'm sneaky, so I'm going to ask a question to the audience. Yeah?
I need to focus on this point as well, because the thing is, connecting to the global network, especially with patients who do need treatment abroad, although we provide them with the E111, that doesn't really mean anything
No.
if the foreign doctors can't access your data,
No.
which you've got in Malta.
No.
So I think that's really important for the completion of care.
Okay, thank you for that. A show of hands, because we've got -2 seconds left. Who thinks we should do it virtually if we have an ecosystem session on data? Hands up. Okay, that's a 0. And in person? Okay, and who's willing to take part? Oh! Big round of applause for our panel, please. Thank you very much.